My name is Zule Zambrano, and I am a third-year resident at Texas Tech University Health Science Center, El Paso.
I am Mohammed Ahmed, third-year emergency medicine resident.
I am Radosveta Wells, currently the Residency Program Director at the Department of Emergency Medicine, Texas Tech University Health Sciences Center, El Paso.
My name is Stormy Monks, and I'm the research faculty with the Department of Emergency Medicine.
And my name is Scott Crawford. I'm a faculty member at the Department of Emergency Medicine and Director for the Training and Educational Center for Healthcare Simulation.
TTU-HSC El Paso, Department of Emergency Medicine physicians serve an 80% Hispanic population. Previously, Spanish language training has been offered to incoming interns during a 1-month orientation with up to 20 hours of classroom-based teaching. But residents still frequently require the assistance of interpretation services for the duration of their training despite this initial Spanish language education. With the regional population of over 3 million people and 80% of those speaking or preferring to speak only Spanish, this is a critical skill to develop. New providers come to train that may not speak Spanish, and this is an important part of their skill development. Communication is the target of many simulation activities, as communication between providers is critical to providing good care. Communication with patients is also critical to understand needs, wants, and limitations of care, but often language can be a barrier. This situation in El Paso can delay and change management on a daily basis, so developing language skill is a crucial aspect of care in this region. Using simulation as a language instructional tool has not been evaluated in literature.
This allowed the assessment of the prior training practice to identify if integration of Spanish language simulation was a worthwhile activity to develop and use during the emergency medicine resident orientation process. In the book, English for a Specific Purpose in Theory and Practice, it is discussed that language training taught without a direct purpose almost always teaches too much. But a direct approach for a specific purpose has better ability to match learners' needs. It is with this concept in mind that a simulation-based approach to Spanish language has been pursued.
In order to accomplish this type of language activity, a simulation center design that favors real-time audio communication is required. Audio systems that support this communication must have an analog system to prevent delay from digital to analog conversion that tends to make communication choppy and difficult to follow. In addition to this analog communication system to speak with learners in the room, a digital system that allows broadcast and observation by learners in an adjacent classroom was utilized to allow groups not directly involved to continue practicing the skill of listening to vocabulary and for the history and presentation of the cases. Simulation-specific training was also conducted with the language interpreter to ensure consistent and realistic portrayal of all 25 simulation cases. Often, small variations in language terminology were required to ensure realistic portrayal of presenting signs and symptoms, as a unique vernacular is often used by patients instead of formal or textbook terms that may be traditionally taught related to anatomy and symptomatology.
For this study, we took 2 groups of residents. The first group, PGY2, PGY3, and graduates of the 2018 academic year, received traditional didactic training. This was classroom-based Spanish training with an instructor. The second group of learners were those PGY1 students for the 2018 academic year. This is the first group of students that we put through a combined Spanish integration and simulation curriculum. Both groups of students were given surveys asking questions regarding the satisfaction and the perceived effectiveness with their respective training. Here is an example of the integrated Spanish and simulation training environment. Contrary to standard summative style simulation cases, use of external aids was encouraged both for medical knowledge and to assist with language and vocabulary. This is believed to help reinforce use and retention of terminology, but it also allows practice of resource utilization at the bedside to improve care.
Results. It was identified through retrospective survey analysis of the traditional language training that this method of Spanish instruction was viewed as effective in only 53% of residents surveyed, while an overwhelming 100% effective response rate was obtained from participants in the immersive simulation-based language training activity, regardless of prior language abilities. Here is a summary of the specific results. One item of note is even those who were fluent could focus on the medical care provided or assist with interpretation for members of their team to ensure a common understanding to facilitate patient care as a group, without feeling bored as may occur in a traditional language course. And here are our conclusions. Overall, study findings suggest that both training methods were seen as effective, while the integrative Spanish training was the preferred method. Residents felt more confident with medical Spanish after completing the simulation course. Direction in the future is to continue this project at Texas Tech University Health Sciences El Paso with the hopes of expanding the application to other residency programs or into other regions. Special thanks to Ms. Connie Gayanis, who was our interpreter and Spanish teacher in this new project. And special thanks to all Texas Tech University Health Sciences Center El Paso Emergency Medicine residents for their great participation.